Hello, everyone, and welcome to the second episode of Hustle and Glow Nichols MD Institute. I hope you caught the first episode last week. If not, you can catch it on our website, kimnicholsmd.com, and we'll also be sending it out to those of you who RSVP'd. But welcome tonight. I'm so excited to have the second episode tonight. So, I'm Dr. Kim Nichols. For those of you who don't know me, I'm the proud owner of Nichols MD of Greenwich, here in Greenwich, Connecticut, and Skin Lab, which is in the beautiful Harbor Point section of Stamford, Connecticut. I'm a board certified dermatologist, but most importantly, I'm also a proud entrepreneur. And I started Hustle and Glow because I wanted to educate people like you in the beauty business about how to procure, to grow, to maintain a loyal clientele, because that's what's obviously going to grow your business. And it's all about passion and profitability. So today, the exciting topic we're going to talk about today is stop talking about syringes to your patients. The key to exceptional results, which they will love and tell their friends about, is using filler packages, also using neurotoxin in there, combination treatments that are going to give them long-lasting optimal results. So we're going to be talking a lot about that today. We're going to be doing a live injection, and I hope you gain a lot of information tonight. So this is our beautiful reception area, which if you guys caught the first episode, we talked a lot about different things that we add in here to really catch patients' eye and give them the greatest experience even when they walk in. So again, we'll go through here, but tonight I'm going to actually show you a little bit about how we set up exam rooms and how that's helpful in terms of, giving your patients a great first impression. So here we're going to come into exam room 6. So just to give you kind of a lowdown, we have 8 exam rooms here at Nichols MD. We have 13 plus providers and also staff, which includes a lot of assistants and such. We have about 12 lasers or devices, including body sculpting. So we have a lot in there. This is a room that we use mainly for new patient consultations. And just a little thing, we love to add a little, make patients feel at home, add some wallpaper, make it feel less clinical and less doctor office like. One thing that we use a lot is this skin ceuticle scope, which allows patients for us to look at them and see some of the age damage in this UV light. They really like it, and it's something that you can kind of take them back to later after you've done some treatments, use some excellent skincare, which of course that we display here, and they can see the progress of their skin, because it's so important, and we'll get really into this later about consultations, is seeing, before and afters of their skin. One thing that we love to do is show them what's new. Patients always want to know, even new patients want to know what's new, what's hot. And we actually have kind of a what's new, what's hot placard that we change every quarter. That's another thing that I find to be really important. Make sure the displays and such and the information that you're giving is changing. Your loyal patients don't want to see the same stuff all the time. So make sure that you're changing that and telling them about what's new, because, remember, especially in our industry, there's something new all the time. So they want to know and make sure that they're going to the right place with somebody like yourself who really keeps up with the latest trends and the latest techniques. Another thing that you'll see here on the walls is, of course, credentialing yourself. So we like to put not only degrees and diplomas, but also articles that, I've written or some of my staff have written, just to credential us and talk about different subjects that they can see. So again, this is exam room 6. This is our main new patient consultation room. So we'll take you through. We have a U-shaped office, which again is excellent for privacy, so patients don't have to be kind of crossing each other, going back and forth. This is our 5th exam room, and this is our lovely patient who's going to be modeling for us tonight in the live injection, and of course my beautiful physician assistant, Caitlin. So we'll keep going sort of around the U, and we're actually going to get started pretty quickly on the didactic in terms of talking about what we're going to be discussing today, which is the topic about talking less about syringes and always about filler packages. So let's get started. Okay, so again, the topic today is to stop talking syringes, and the key to exceptional filler results is to package for optimal cosmetic outcomes. And welcome to all of you who are starting and getting on right now. I hope you get a lot out of this presentation. So these are some of my disclosures. I just wanted to bring up the fact that, always present your disclosures whenever you're doing presentations. Please don't visually record any of this presentation. I swear to you, it'll be available as a recording on our websites and emailed to all of those who RSVP'd. So please be sure to RSVP. A little bit about me. So I'm a proud New Yorker. I did my residency out in LA and then came back to the East Coast. I started out on the Upper East Side for about 7 years working for another dermatologist, and then started my practice here in Greenwich 8 years ago. And we actually started Skin Lab about 1.5 years ago. So expanding, exciting, and hope to be spreading out even more. So my philosophy. So for my patients, it's always to look your best, right? We're not here to make you look like a celebrity. We're not here to make you look like somebody else. We're not here also to make you look 20 years younger, even if that was possible. We're here to make you look like the best version of yourself so that you feel confident going out into the world. And that's why our hashtag is natural at Nichols. So when you follow us, and please do, you'll see that hashtag everywhere, because it really is my philosophy. And I think if you spoke to a lot of my loyal patients, they would agree. So for new injectors, and I know there's a lot of different levels of providers here on this webinar tonight, the most important thing, and especially with filler injections, is to know your anatomy and to start slow. Don't try to do everything all at once, even though you might watch Instagram videos that look like you can do all of this the minute you get started. First of all, it's not safe. And second of all, it's something where, your patients want to be confident in the first thing that you do. So make sure you become an expert at whatever it is, and then move on and gain knowledge and move slowly. Start slow, because it's going to be the thing that really grows your practice, and make sure that you're doing the first things right. Marketing, credential you. And we'll talk more about that actually in our third webinar, which is coming up in a couple of weeks. But definitely market you. There's a lot of people out there who say that they can do the same things that we do, and perhaps, for less money, but patients come to you and pay more because they want a physician or healthcare provider who knows their stuff, and that's why they come to you. So credential you, be proud of your degrees and what you earned to get here, because you're not here to compete about the product. You're here to talk about why you do it better. And the key to success, you see this gorgeous picture of my beautiful team. It's really the core. I mean, I say this in every single talk I do, but it's really the core of why we're successful and why we continue to be. And that's what patients always report in all of our reviews. And every time they speak to me, they always talk about how amazing my team is. So let's get into it. So we've all seen these type of photos of a daughter and a mother, right? And the aging process. We all know what the features of a youthful mid-face are, even though we might not be able to, a layman might not be able to exactly word it, but things like bright eyes, that are open and bright, a high cheekbone, a heart-shaped face that you see here on the daughter on the left, and of course the lack there of jowls. So the triangle of youth and the inverted triangle. Again, this is something that a lot of you have seen, but it's something that you really should bring up to patients. And I actually show them these photos really to point out some things even before we go through the actual pictures of themselves. So you see here the daughter on the left, right? So she has the triangle pointed downward, where the malar eminence is high and beautiful right under the eye with the OG curve. I tell patients that's the Nike swoop of the cheek. Her face is heart-shaped and oval, with everything upwards. Then we go to the mother or grandmother here, where we see the inverted triangle of youth. And, patients may not know exactly how to express it, but a lot of them just say everything is just going south. And they're right, they're completely right. So we see here that the concave anteromedial and submalar regions under the eye, that separation, which of course patients will describe as under eye circles or hollowing, and we'll get more into how that happens anatomically. Cheek deflation, which then leads to a prominent nasal labial fold or deep nasal labial fold, increased length of the cutaneous upper lip, loss of volume in the lip itself, of course, the lines that then occur, and of course, the marionettes and the dreaded jowling of the lower face. So we can see that a heart-shaped oval up face then turns into more of a rectangular or square face. And that's what we're trying to improve when we talk about using filler packages. So getting into the anatomy. Now, I actually do explain this to patients. I mean, I'll tell you, you don't have to get too technical for patients to understand some of these things. And I really explain it to them. And sometimes I use, these type of kind of cartoon photos to show, but that aging is not just about skin falling. We literally are losing bone. And that scares people, but it's true. We're losing the scaffolding that's holding everything up. So it really helps when you start to have that filler conversation, they're understanding that, hey, it's not just about, improving or getting a little bit more skin or thickness or lifting. It's actually about replacing some of that volume loss that has come from bone resorption, from these fat pads. If you can see here in the cartoon, you see the age 35, all the fat pads are nicely abutting each other. As we age, they start to, almost like I explained to patients, like islands start separating. And we see that separation in things like nasolabial folds or in, of course, deep hollows or concavity under the eyes. And then you see how this kind of worsens over time. Now, what's happening to the skin? Well, we're also losing elastin, we're losing collagen, we're losing hyaluronic acid, all the things that make our skin youthful and our dermis thick. So, I explain this to patients because we do everything here, right? So it's not just about volumizing the face to replace some of this bone and tissue loss. It's also about increasing elastin with some of the type of laser procedures or collagen rebuilding procedures or devices. So it all goes together. It's also neurotoxins that will help to slow down the process of the muscular movements that cause these deep upper face, especially lines. So it all goes together, and that's why all of these treatments come together into a comprehensive program to address these issues for the patient. So consultation pearls, and now we're going to get into the meat of talking about filler packages versus syringes. So syringes is very much like sort of the units versus areas conversation. We're talking about neurotoxin. That's what actually I addressed in the first episode last week. So people think, well, can you just come in and fill up my nasolabial folds or fill up this line on my cheek? And really, we have to start from the beginning in educating patients. And this is really exactly what I do. So the first thing we do when a new patient comes in is we take before and after photos. And I know if you've heard me talk before, I'm just, so big on this because even before they've decided to even do a procedure with you, it's important to take photos of them so that you can sit and show them their real selves. I mean, using a mirror is okay, but I find that especially when you want to look at different angles, it's hard to do that with a mirror when you're doing a consultation with a patient. So what I recommend is that you have your staff take before photos or take photos before you walk in for the consultation when they're doing sort of the intake process. You have that on the iPad, and then I literally sit next to the patient and review the different photos, all the different angles. And it's important to show them the different angles and expressions. We know that to be true, of course, when we're talking about neurotoxins as far as facial expressions, but it's super important when you're talking about volumizing with fillers. So I have them tilt down. That's a very good position because sometimes people don't realize what's happening unless they tilt down and they can see that photo when you're showing it to them on the iPad. You want to evaluate the patient's unique anatomy together sitting down.
the first thing you want to do is, I talk to them a lot about the aging process and things that I see that are happening, in their face as far as the aging is going. They'll point out things like, nasolabial folds or jowls. And I express to them in talking about what's happening that these are actually symptoms of the problem. And the problem are things that we discussed in terms of, bone loss and loss of elasticity and collagen in the skin that causes this falling. And I really literally show them that, that then causes these symptoms. So in fixing these symptoms, we have to adjust from top to bottom to get that restoration, to get more of that heart shape back, to address these issues. It's not about just filling with syringes. And once you explain that to them, show those things on their face, they really get it. They really, really do get it. So it's really important, to start from top to bottom. And while I'm doing that, I always also show them their best feature. Sometimes it's great to ask them what they think their best feature is, but a lot of times that makes people feel, a little bit awkward about saying something nice about themselves, especially if they're feeling not so great. So I always point out their best feature, and it really, of course, perks them up, obviously. And I tell them that, look, I'm going to be recommending these type of filler packages as volumization because I want to highlight this best feature of yours. So let's say it's the eyes, right? And I tell them, look, you got great eyes, big eyes. However, this, falling, sagging, loss of volume is not really highlighting that feature. So if we return or restore some of that, it's really going to draw the eye of the person looking at you to that great feature of yours. And they really get that. So again, it's a great tool in terms of consultation and when you're discussing that with the new patient or no patient. So again, start from the upper face. Restoration needs to be full face in order to look natural and lifted. So see, these are some of my real before and afters of real patients that we've treated. So here we have a patient on the left, gorgeous woman here. She's 57. She came in and she wanted a little Botox. She'd had it before. She liked it. She said, it didn't last that long, but, she liked the way it looked around, lifted her eyes a bit. And I told her, I said, great, we're going to do that. But let's talk about what else is going on that I see. Because she said, can I want your opinion. That's why I came. That's why, I'm, paying to come here. And I showed her these photos of the before. And I said, look, what we're losing here is, and I explained to her in terms of the face and the lower face and how it's all a continuum, not just about using a neurotoxin to treat the upper face. And when she saw these photos, she was like, wow, and she really understood. And she bought into it, literally and figuratively. And look at this after photo. I mean, I can't tell you. I mean, elated is not the term. This was 2 weeks after she had, very minimal downtime, and she literally felt that she looked 20 years younger now. And I think she does, but yet she still looks incredibly natural. Here we have a patient on the right. She actually is in her 60s or 60 years old. She wanted, of course, she's a layman. She wanted fillers for a tighter neck. And in the consultation, I explained to her, look, I think we should start with doing a combination of treatments in order to get to your goals. So we actually ended up using microfocus ultrasound energy device that was used to tighten her lower face with collagen building there and her neck, which you can see. We used a filler package in order to get a beautiful upper and lower face contour of her cheeks and jawline. And we also used neurotoxin. And I mean, again, the pictures speak louder than words. This is a beautiful after, and she was thrilled. Here's another patient. I think the one on the left, she's 62 years old. She actually, even in the before photos, looks young for her age. She's very fit. She's into fitness. She came in saying she didn't want a lot. So I said, that's fine. But we actually ended up doing a whole package of fillers and neurotoxins because I really encouraged her to kind of just trust me. And we got this amazing result that you see here on the right. And it's funny because when she came in for the follow-up a couple weeks later, which you see here in the after photo, she was so thrilled that, of course, she wanted, more and different treatments to even improve the outcomes going down the road. So now I've gone from a patient who didn't want a lot to somebody who's so thrilled with her result that she wants to be a loyal patient forever. And she's actually come, I think, 5 times since this first one. So there's the business side of it. Then we have a patient on the right here who feared a drop brow, which she had at another office previously with the use of neurotoxin. And she already has sort of a heavier brow, heavier eyelid. And we ended up doing a total eye rejuvenation with the combination of microfocus ultrasound, which helped to tighten the little crepiness under the eye, PRP, because she had some festooning, so she was a little bit afraid, and I didn't recommend hyaluronic acid fillers under her eye. And then we also used neurotoxin and microfocus ultrasound device for lifting the brow itself. So look at how open her eye is in this after photo. This after photo was about a month later. And we also do the same thing for young patients, right? So it's not just about the aging process. People genetically have issues that they might, want to address. So it's not just about aging. So here we had a patient who's 29 years old, right? Young patient. And she wanted just a more defined jawline. And this is becoming even, more popular, of course, because these young people are on Instagram and other social media all the time. They're constantly taking photos of themselves. And this chiseled sort of jawline or contoured face is really the thing. And that's what she wanted. So I suddenly did a package of jawline contouring and chin enhancement. Chin was something she knew she wanted a more contoured jawline, but she didn't realize that the chin was all part of that. And that I spoke to her about in the consultation, and she couldn't believe the result. She was so happy. Now we have a patient here on the right who's also a younger patient. She came in actually wanting under eye filler. And during the consultation, I spoke to her about, kind of what I saw, which was, she had beautiful eyes and lips, but I think that it wasn't being highlighted because she sort of had more of a recessed chin and a little bit of submental adiposities. And I wanted to sharpen up her jawline. So we actually did a combination of deoxycholic acid with some jawline contouring using fillers in the face, the cheeks, and the jawline, and some neurotoxin. And wow, this was an amazing result, and she was so thrilled. So when you're speaking to a patient, and this is exactly how I can do consultations with the patient, I talk to them about the benefits to restoring the face as a whole. So here are their benefits. You're going to be happier. I just showed you 6 real before and afters. I could show you a lot more. You're going to be happier than if we just fill a nasolabial fold or do an under eye. You're going to be happier if you do this package that I'm recommending for restoration. And the results are going to last longer. So I explained duration, and studies show that 84% of patients are willing to pay more if they know it's going to last longer. So when you say, look, we want to fill the tank, I want to fill the tank so that you only have to come back for little retreatments and just keeping the tank full. We don't want to go all the way back to empty by doing 1 syringe and then in 6 months being back where we were baseline. When you explain that, I actually use the whole gas tank analogy, and they get it, then we're just going to have to just keep topping it off, and it's just going to last longer and longer, and you're going to need less product for retreatment. So those of your patients who are budget conscious, and I completely understand, I tell them, look, if budget's an issue right now, that's fine. Come back when you're ready to do the whole thing in terms of your budget, because in the end, it's actually going to save you money, and you're going to get longer lasting results, and you're going to get results that you love. And also downtime. So for a lot of patients, I'll explain to them that, look, instead of doing this in 3 parts, let's restore the whole face. That way, any, bruising or swelling or all that kind of, we can just get rid of and done with in a quick time, as opposed to having to repeat it multiple times to get the result we're looking for. And for the business, because it is a business, it's the beauty business, happy patients, of course, will lead to increased referrals, increased tenure and loyalty of your patients, a great reputation, happy patients write great reviews, UPTs, and of course, overall profitability. And that's really one of the goals, of course. Injection technique pearls. And we're really going to get into this, of course, in the live injection. But the number one tip I would say, and I said from the beginning, is you have to know your anatomy. That's why patients are coming to you, especially with filler injections where you can get into big trouble if you don't. You have to know the caution sites. Don't try to do everything at once. Learn, one type of filler package down cold, repeat, and then move on to something else as you get better and better at it. And have a clear displayed, written out patient complication protocol. So this is something that's very important, because when you inject as many patients as I do, most everything's going to turn out great, but sometimes you can get into an issue. And, if you have something like a vascular occlusion that's impending, you want to have this protocol ready to go, have the inventory ready, have follow-up ready, have your staff ready, have everybody trained. So you want to have this, you don't want to be digging around, searching around about what to do at the last minute. So this is super important, because if you're going to do these things, you got to be able to undo if there's any complications. Now, again, this webinar today is not about filler complications, but it's something that, and I'd be happy to give you, if you want to DM us, information about where to look for some of these protocols and algorithms, but it's something you have to know cold before you even jump into this world. And these are, of course, some of the areas of caution to think about. And on the right, the algorithms, and this is just a basic algorithm. They get much more detailed. And again, you can always DM us for those sources about areas of caution to look out for. So very excited. We're about to move on to the live injection, which I know you guys have all been looking forward to. This is our lovely patient model that we're going to be injecting today. She is 60 years old. She is new to all injectables, so this is going to be fun for all of us, and we can't wait to start and see her after results in a couple of weeks. So give us 5 minutes, and we're going to get started soon. Thank you.
Hello, everyone, and welcome back. We're here now to start the live injection with our beautiful model, Lorraine. How are you, Lorraine?
Fine.
Good.
Fine.
So tell us, if you don't mind me asking, I know we normally don't do this, but how old are you?
60.
You're a beautiful 60.
60.
And tell me, have you ever had any sort of injections or cosmetic treatments? And if so, what?
Nothing.
Nothing.
Yeah, I have not had anything.
You're no facials or anything?
Oh, I guess facials.
Okay.
Yeah, I've had facials.
Some people, but yes, this will be Lorraine's first time in terms of
nothing too significant.
Yes.
At all. Yeah.
Right. So tell us, and this is really what I do in a consultation with anybody, and we're going to be doing real injections with you. What has started to bother you, about, the aging and everything else?
Yeah, I think definitely I'm seeing and feeling, this looser skin, got my neck all around my jawline and some lines around my lip, which, was not apparent before. So.
Yeah, and these are all natural things that happen. I was explaining sort of in the presentation earlier, because as we age, different compartments of our face, even our bones starts to, we start to get some bone loss in our skeleton, the skin thins. So all the things that you're seeing are part of what is really happening. So today we're going to try to restore some of that with the use of both fillers and a little thing called neurotoxins that will help to kind of soften the muscle movements and really to get you a beautiful natural look. So looking at Lorraine, so she's already been, cleaned and everything. We've already gone through some before photos of her, like I showed you earlier, in terms of the iPad and consultation. And I made some recommendations to her about what I think will get her a great overall result. And doing, as we said, starting from the top to the bottom. So, Lorraine use the words in terms of, I'm sagging here, which is of course what a lot of patients are going to complain about. So, in using what's called a facial jawline contour package, which I'm doing today with the use of 2 different fillers, we're going to get some natural lift here and also some more definition that's going to show Lorraine a tighter lifted jawline and also lifted cheeks. Now, important, especially when you're dealing with a patient, who's 50 or over, I always give them realistic expectations, right? So this is something that's going to be an in-office procedure. She's going to love the results, but this is not a facelift. This is not a neck lift. I got a lot of people I can send her to if that's what she's interested in, but you have to set that, expectation up before you get started, because otherwise you could have a disappointed patient just because they don't look 30 years old. So again, we set that up and patients are usually fine with it, but you also have to always mention that to them. So let's get started. So we're going to start with one of the type of neurotoxins that are used in the upper face. It could be super natural. You're still going to have movement, and it's really just going to help to most importantly lift the eye area. It's not just about getting rid of lines, okay? And we're going to use a tiny needle. All right. So one of the things, if you guys saw us last week, we love to use this little vibrating distraction device. So Lorraine, give me like a kind of a frown in here. Good. And release. Great. And then close your eyes for safety. And we like to use tiny needles to make patients feel as comfortable as possible. Great. And please, guys, if you have any questions during this, we're going to be doing questions at the end, but even sometimes in between. So please, in the question box, give us your questions and we will get to as many as we can. Now, Lorraine, lift for me like you're surprised. Raise your brows. Good. And then release. Perfect. And Lorraine does not need a lot in her forehead. Just giving her some softening. I like to spread it out. Great. And lastly, we're going to do a little bit in the orbicularis oculi, or the crow's feet. And that's mainly not to get rid of all the crow's feet, but really to open up that lateral eye that starts to sag as we get older. Lorraine, how are you doing?
Fine.
You're doing great on our
Fine.
side. So.
Fine.
And Lorraine, this is going to kick in about a week to 10 days for most. Now turn your head all the way towards me. I'm just going to do that other side. Perfect. And you can close your eyes for safety. Great. Lorraine doesn't need it, but she did. Okay, so we offered her a little stress ball. It's always good to help patients feel comfortable, especially those who are new to injections. Excellent. All right, so now we're going to start with the facial jawline contour. And the first place I start is going to be the rami. So Lorraine, I'm going to have you turn all the way over here. And this, Lorraine, is going to be right sort of in the L shape of your, your jaw there. So you're going to feel just a little bit of a prick. And these results, you're going to have a little bit of swelling in the area, maybe a little bit of tenderness, nothing crazy. But these results will really show up when that goes away, which is usually about 3 to 7 days at most. And then you're really going to be able to see that lift. Now, importantly, which we discussed in the didactic, is that I always bring, especially patients who are doing sort of this full face facial jawline contour, I bring them back in 2 weeks for a follow-up visit. For some of them, they might need more. They also just want to be reassured about how they look and they love it. But do that, especially for patients who are new to it. They want to be reassured. They want to see you. They want to see the before and afters. And it's a great way to show them how far they've come in literally like a couple of weeks. All right, Caitlin, I will take the cannula. So I use a mix of needles and cannulas for all of my filler packages. For those of you who are not familiar with cannula use yet, really, go to a course There's so much out there now. I tell you, it's the future. I love cannulas. You know, Asia and Europe have been using them forever, but now we're all using a combination of both needles and cannulas for different uses. So here I'm gonna have Lorraine. I hope you guys can still see us here, and I'll have you turn almost 9 degrees, just like that. Oh, important. So you see how I tell the patient in the beginning, I'm like, you're gonna be on a roller coaster today. And what I explain to them, what I mean by that is, and this is why we got those good chairs that go up and down easily, is because you know, you need to be comfortable as the injector, right? So you can't be kind of squirting around and doing all this and ended up, you know, doing some things that don't work out right. So I tell the patients, I'm gonna be moving you around a lot because that's what I need to do to get the best result so that I can be comfortable and they get it. They say, well, I'll do whatever you say, doctor. So I have Lorraine turn. In fact, Lorraine, you can even turn a little bit more for me. A little pinch. Good. Okay, then you can move that. And I'm using a 22 gauge, which I love. A4, you know, it's one of the safe, they're larger gauges. You know, we can never say completely safe, but it's one of the safer ones for the use of fillers in terms of avoiding vascular occlusion, of course. And another thing is you see that I'm injecting slowly. And some of these Instagram videos, I swear, I mean, I know they speed them up, but it really makes it look way too easy. And I get scared. I get scared that people are injecting way too fast. So I inject slow, not only for safety, but also for patient comfort, especially when you're coming through with a cannula. There can be some areas there where you have to go through some fibrous tissue that can be a little bit uncomfortable for the patient. So the slower you go, the better. How you doing, Lorraine?
Fine.
Good.
Yeah, fine, thank you.
Almost done with this side in terms of the jawline. Beautiful. And I explained to the patient that, you know, you're going to have a little lumpiness, feel a little lumpiness there, a little swelling for a few days. That's all going to integrate. This filler in particular integrates beautifully in this jawline area. All right, now we're going to go exactly the opposite way. Yep, perfect. And I hope you guys can still see me. I'm going to start with the cross of the ramus again with the needle. Right, and feeling for that. Little pinch. You don't need a lot here. For men, sometimes I'll, you know, of course, I'll need more product, and we can answer questions about things that are particular for men in terms of filler packages. And, you know, it just brings up the fact that this is, you know, a patient would never know to think about any of these things unless she had a husband or a wife who was a dermatologist or plastic surgeon. So again, it's your job to help them, you know in terms of what's going to give them the best results. If I had a patient who walked in and said, oh, I want a facial jawline contour with this, that filler, and the other, I would actually be a little scared. I'll take the cannula. All right, a little pinch, doing amazing. And other things you want to point out to patients, and that's why it's so important to come back for that 2-week follow-up, is some natural asymmetries that they might have. We all have asymmetries. In fact, asymmetry is a good thing. I'm just getting through a little tissue here. But you want to point that out because you want to show them, you know, that you don't want them to come back and say, hey, this is what this treatment did to me. You want to show them that they had that prior, that if they want that improved a little bit, if that's something that bothers them, we can do that. But of course, it's better to do it after you've already showed them. All right, now we're going to come to middle. Beautiful. And now we're going to start with the cheeks. And we're going to raise Lorraine up a little bit. And she's actually got beautiful cheekbones. I mean, it's really, again, this is definitely one of the just enhancing it type of things, because you can see she's really maintained that OG curve. What I'm gonna do is focus sort of on the lateral cheek here to get a little bit more lift there. I'm not gonna do a lot here. You know, she's still maintained that beautiful cheekbone there. So thank your mom and your grandma and everybody else, and your dad too, I think. All right, so we're gonna start a little bit in the apex. And this is one of the hyaluronic acid fillers that we're using today. And people often ask, you know, Dr. Nichols, what's your favorite filler? What do you? I use them all. I use them all sometimes in one treatment on one patient. So again, it depends upon what I'm treating, what's my favorite for that, what the patient is presenting to me. Of course, if a patient has any sort of you know, allergies or something to a product, we wouldn't use it, but that's rare, and I rarely see that. How you doing, Lorraine?
Good, I'm fine.
Good. And I'm on bone here in terms of these treatments. I'm going to do a little bit here. And on bone. I'll take another gauze. Perfect. And I'm actually going to thread a little bit here in this little hollowing here of the submalar area, which I like to do in small little kind of micro boluses. Another way you can fill that area is by using a dilute form of some of the fillers out there. That's another webinar. All right, I'll take some more gauze. A good amount, good. Yeah, good. All right, Lorraine, so we're almost done with this cheek area. I'm gonna do a little bit here, more threading there. We supply, Lorraine might have a little bit of bruising here in this area. We supply arnica cream to our patients and little pellets. We also have a bruise laser that they can come in for complimentary, which really helps them go away faster. All right, now we're gonna move on to the other side in terms of the cheek. Can you guys still see me, I hope? We're basically gonna do about the same. I mean, she really has a great cheekbone here. So it's going to be a matter more of highlighting the lateral cheek and lift area. And again, I'm on bone. And I like to really, you know, touch and massage the areas that are treated after the treatment, which you'll see. It feels good for the patient, and it also is a nice way to help smooth things out for them. But I still warn them that things might look a little bumpy or feel that way, especially, you know, when they're washing their face or touching the skin for the first several days, but that'll all integrate and look great. You know, I'm big on setting expectations and telling patients what to expect ahead of time. So, come back and we can clean up this area. Beautiful, but we're already seeing some nice lifting. Great. And then we're going to make her even. I'm going to bring her down. And Lorraine, we're going to make you a little bit even more 90 degrees. And Lorraine, if you could just kind of put your head down for us. Perfect. Great. So we're starting to see some lift here already. But now I want to address this chin area because, again, it's all part of the same continuum that's going to give her a sharper and more heart-shaped and lifted lower face, especially when this sets in. So I'll take the cannula again. And here is this perioral volume loss that I want to adjust. I'm going to use a little bit of neurotoxin just to bring down the mentalis so that that cheek is more down and defined. And you are doing amazing. I want to point out something. We're not going to be treating the lip lines tonight or the lips themselves, but oftentimes I do that all in one treatment, explaining to the patients that it's you know, part of the whole structure of the lower face. We won't be doing that just for time's sake today, but it is something that concerned the patient. So when she comes back for her 2-week follow-up, that's going to be something, you know, that we talk about, we could possibly do that day. And I have a nice lip softener treatment, which is a mix of a filler, hyaluronic acid, and neurotoxin that really beautifully softens these lines. All right, so I'm gonna have you turn this way for me. Little pinch. And again, you know, paying attention obviously to all of your artery landmarks to avoid. So Lorraine, you're gonna feel just a little cannula coming through, and you have a ligament right here that you're gonna feel a little pressure as I kind of get through there, and you guys can see that on the video, I hope. And it's just a beautiful way to thread, and you can literally see it in real time, how it's just softening that area, and we can do it without, and know where your tip is, obviously, of your cannula all the time. But look how much, a wide area we can address literally with one poke, as it were. And there is lidocaine in a lot of these fillers. So if you feel a little numbness for an hour or two, that's all going to go away. Now we're going to go to the other side, and we're almost done. You're doing amazing. Good. You guys can see that. So again, and we're going to thread in this perioral area. Some people come from nearer to the oral commissure. I like to come at the end of the nasolabial fold around there so I can access all of the chin area, including this oral commissure area of the marionette, so the perioral, right? All right, here's that little poke again. God, you're doing so good. So good. You would think you did this every day. Beautiful. And then I'm going to come through and sort of get that corner. And you guys can see here where my tip is. Beautiful. Voila. So we're going to end with just a little neurotoxin in the mentalis. And then she gets a nice massage by me. All right, so a couple of units here. I like to do the DAOs too, because of course that gives the downturned corners of the lips that patients hate. And they always say they look sad when they're not. So, you know, do me a favor, go like this. Good. You see how that pops out, that DAO? And you hit it right there, a couple units there. Couple units there. And then I like to do a straight on mentalis unit. Beautiful. So I hope you guys enjoyed. I'll take a little gel for my free massage, usually not so free. So I hope you guys enjoyed the live injection. And now we'd love to take any questions for me to answer that you guys asked during the presentation.
All right, so Dr. Nichols, we had a great question, which was, if your patient is a newbie, are there any treatments you'd like to start with?
Yes, I mean, one of the first things is, of course, neurotoxin, because I don't think you know, there's not a patient in the world who hasn't loved neurotoxin in the upper face, right? It's around the eyes. And also what we call a little cheek pop. So using some hyaluronic acid in the cheeks, even if it's not a lot, the combination of the neurotoxin around the upper face muscles and then a little cheek pop under the eyes gives them what we call a total eye rejuvenation. And that's a great way to start with a package for a newbie.
Great. And then they wanted to know about your consultation that you talked about. So what is the length, and do you allow time to do treatment at the same time?
Yes, yes. So we allow 60 minutes for the consultation appointment. And in that time, we tell patients that The consult will usually range about 20, 30 minutes, and then we can actually do treatments during that time too. And we're really good at moving patients and get, so a lot of patients come for the consultation, they end up being here for 3 hours, which is fine because we make it happen, especially for patients who maybe it took them a lot to get here, and once they get here and they feel comfortable, they just want to do it. So and they don't want to think about it for another 3 weeks. So we can definitely make that happen.
And then this one came in tonight. They wanted to know what your follow-up is for filler. Is it no news is good news, or do you have a protocol on how soon and when do patients come back for filler appointments?
Right. So for patients, especially when I'm doing something, like a filler package treatment, I really want to see them, even if it's an existing patient that I've seen for years. So I bring them back in about 2 weeks, gives them time for the neurotoxin to engage, for any swelling, any bruising, anything like that to settle in, so that we can really assess their results afterwards. So we make them a pretty standard 2-week appointment. Of course, we give them plenty of notices prior. So if they're like, I'm good, I don't need to come in, then they can always cancel prior.
And they wanted to know what you used tonight and how do you normally decide which product, either toxin type or filler, that you use on patients?
Right. So, I used a bunch of different products tonight. Well, I actually 3 of them. I'm not gonna say brand names today, but I tell patients that, like I said earlier, I use them all. I sometimes use them all in one patient treatment. And because a lot of times patients will come in saying, oh, well, it's so funny. My girlfriend got Restylane here, and so should I get Restylane? And I'm like, well, Restylane is one of the fillers that I use, but blah 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 blah. And this is what I think that we should use in terms of a package. And they don't know what's different. So really, they just need you to tell them what you recommend, and I package it. So that's the whole point of this discussion today. I explain to them what I'm using in that package, but I don't tell them how many or what or all these other things. I say this, and of course the packages are based, in my mind about, of course, time and syringes and that sort of things and product. But again, they just want a great result. They don't really care about what you are using. It's your knowledge base about what you like and what you like to use in certain areas.
So that leads to the next question, which you kind of just answered, which was for a jawline contouring patient in their 30s versus a jawline contouring patient in their 60s, does that differ in price?
I mean, it might, right? Because of course we might need more product in order to get a good result in a patient if they're older. But again, it depends what we're looking at. It could be, a patient who's older, who's been keeping up with things pretty much, for the last 30 years and may, like I said, they're just topping off of that tank because they've been, instead of, waiting until it's empty. So again, age is not necessarily a determinant about price in terms of packaging.
And then they want you to explain the difference between how you price by toxin and how you price by filler. Is it the same price? Is it different pricing?
In terms of, by singles?
Yeah, I think people want to know for the upper face if the Botox is a different price for like a lower face rejuvenation, or is it one price for everything for full face?
I mean, it could, so if I'm doing a full face rejuvenation package, I don't, differentiate in terms, I just put all that pricing together into one price. Now, if I'm doing, let's say Botox, like we talked about in the first webinar last week, if I'm doing Botox of the upper face, I charge by area and not units. So definitely watch it so you can get particulars about that. But those are the, 3 areas around the upper face, which is of course brow, forehead, and crow's feet. And about 92% of my patients end up doing all 3 areas when I explain how they all function together around the eye. Now, when I'm doing something like a mental crease or a chin softener, we call it, I'll charge, by area in terms of that. But of course, it's a smaller price because we're using less units.
And then the next question is, what do you tell the patient who doesn't want to pay for what you actually consulted them for?
Excellent question. So and we do it in a very nice way, but, I'm really confident in what I do, and I'm really confident in the result that I think they're going to love and it's going to last long. But I'm also, conscious of people's budgets and people's budgets, just because we're in Greenwich doesn't mean everybody has a Greenwich budget. So I explained to them, look, this is what think is going to be the best for you. When you're ready, budget-wise, come back and we'll do it. And I promise you'll be happy and it'll last a long time. What I don't want to do is do half of it and then you're half happy, but you've still spent a good deal of money for you and you're not satisfied. And they get it. And then they, you know, some of them just say, you know what? I'm going to find the money somewhere. Well, let's do it today. Some of them say, okay, well, let me take some time and think about it. But I'll tell you, most of them end up coming back and doing it.
And then switching gears, somebody wants to know, what are some of the red flags of a more difficult patient?
Oh, that's a whole nother hour. What are we talking about here? So I'll keep it just to, and the majority of our patients are amazing. So let's not even start there. But I'd say one of the red flags is somebody who's, you know, who keeps trying to break you down in terms of units and syringes. And my friend got this, and she only paid this, and you know, that's a red flag for a patient who whatever you do is not going to be happy and really doesn't, maybe doesn't want to pay for the result, you know, the amount that is needed to get the result she or he is looking for. So that, I think, in this context is a big red flag. And those are the patients that I say, thank you so much. And I think, you know, you might be happier getting treated somewhere else, or go to the person that your friend went to get your friend's result.
And then lastly, how do you respond to somebody who says, how many units do I actually need?
Again, you know, if they really want to know, I explain to them the amount of units based upon their anatomy. And again, we talked about that last week a lot in terms of neurotoxin, because everybody needs something different. For instance, you know, males need a lot more units to get a good effect, and thus their package pricing for neurotoxin is higher than for a woman, and that's just based upon product needs for their bigger muscles and for their anatomy. So again, I will talk to them about that, because it definitely has nothing to do with what their mom uses or how many units their mom has or their friend. It really is based upon what I see in terms of their anatomy.
So we don't have any more questions, but maybe just let people know where they can ask more questions if they need to.
Yes. So you can ask more questions on our Instagram, which is NicholsMD_dermatology, or Skin Lab Nichols MD. And you can DM us. We're constantly checking, in terms of questions that we can answer for you that come and follow up. And even if they don't, you don't come up with them now, please definitely tune in 2 weeks this time, not 1 week. We're going to be talking about marketing you. So really getting into credentialing yourself and differentiating yourself in this, what might seem like a full market, but there's just so much business out there. So really, I think I'm really excited about that one. So you can ask some more questions on that day too, if they come up later, but please tune in. That'll be July 13th, same time, 6 to 7:30. And we look forward to seeing you then. RSVP. Thank you guys. Have a great night.